Hi, I'm Dr. Michael Calderwood, Chief Quality Officer at Dartmouth-Hitchcock Medical Center. Recently, state officials confirmed that an unvaccinated person contracted measles in the state of New Hampshire, and there have been a small number of additional cases related to community exposure. At this time, we're not aware of community exposures after July 7th, but we're actively monitoring for additional cases in the community, as symptoms can develop up to 21 days after an exposure. Thankfully, most people are vaccinated against measles as children, and the vaccine provides lifelong protection against the virus. For those who are unvaccinated, however, measles is highly contagious. In fact, it's one of the most contagious viruses there is, with 9 out of 10 people without immunity contracting the virus after exposure. I want to take some time to answer some of the most commonly asked questions about measles. How is measles passed from one person to another? Measles is spread from one person to another through the air. This includes when someone's coughing or sneezing or talking. What are some of the common symptoms of measles that I should be aware of? Measles often starts with a fever, some fatigue, and maybe a poor appetite. Shortly thereafter, someone might develop a cough, runny nose, and red eyes. Some will see raised bluish bumps in their mouth, but most commonly, what we're looking for is a rash that can develop 2 to 4 days into symptoms, starts on the head, and moves its way down the body. Now, most people will get better on their own, and the illness typically lasts 1 week. If you have symptoms, what should you do? We recommend calling your primary care provider. We also have established a hotline here at Dartmouth-Hitchcock Medical Center. That number is 603-653-1818. And we are available to answer questions. So why are we seeing an increase in measles cases? It's pretty simple. When vaccination rates are high, we lower the chance of people getting sick. But over the years, we've seen more people opting out of getting the measles vaccine, as some people incorrectly think that they don't need to be vaccinated against this illness anymore. And when a person infected with measles comes in contact with other unvaccinated people, the virus can spread very quickly. Do I need to be concerned if I was exposed to someone with measles, but I've already been vaccinated? The measles vaccine creates lasting protection against this virus. And if you've received the 2 doses of the vaccine, you are 97 to 99% protected against illness. Are the vaccines safe and effective? Years of scientific studies have shown that the MMR vaccine is very safe. Most people do not have any issues, and very few people may experience some side effects such as fever or rash, but these are limited and typically resolve. How quickly does the vaccine take effect? Protection from the MMR vaccine begins within 2 weeks of getting the first dose. If I was vaccinated as a child, am I still immune? The MMR vaccine provides lifelong protection against measles, and so you should not need to get a booster or additional vaccine if you previously received the MMR vaccine. Some people may have received a single dose, but most have received 2 doses. In general, 2 doses of a measles-containing vaccine is recommended for school-aged children, college students, healthcare professionals, and those who travel internationally. What is the best treatment? The best treatment is prevention. We strongly encourage everyone to get the MMR vaccine. For those who have been exposed, you still have time to get the vaccine shortly after the exposure, and we do have available protective antibodies in the 6 days after an exposure. We really appreciate the questions that continue to come in from the community, and Dartmouth Health is here as a resource, and again, we have the hotline that has been set up. Please reach out if you are concerned about exposures, about symptoms. We have the ability to test and ensure that you get any treatment that is required. Thank you.